Each story, a rivet. Each meeting, a cable. Each study, a span. Each accomplishment, a tower. Each bridge, a milestone. Each milestone, a step closer in the journey to a cure. If cancer is to be conquered, the assembly of resources, the sharing of knowledge, and the free flow of energy, intellect, and passion is essential. Bridges must be built. The Michigan Cancer Consortium, or MCC, is an organization of organizations that are working together to fight cancer. These organizations come from every corner of the state. They represent the different faces of Michigan. Rural health departments, urban health systems, community-based organizations, research institutions, and more. Although very different, these organizations share a common mission, a common goal: to control cancer and provide hope to the residents in Michigan.
The Cancer Consortium brings together different organizations, and the way the consortium addresses cancer is to develop a coordinated and comprehensive approach, and we're focused on results-oriented and evidence-based prevention, early detection programs.
One of the key elements was to agree on 10 objective goals for the organization. These involve reducing cancer in all of the common cancers, breast, colon, reducing smoking incidents, but also other issues like participation in clinical trials and issues of quality of life and end-of-life issues.
We have been able to make substantial progress. We've been able to reduce the prevalence of tobacco. We've been able to get the breast cancer mortality heading in the right direction. We have been able to see prostate cancer begin to decline. We've made some real progress on the development of a systematic approach to colorectal cancer.
People's lives are at stake, and the lack of education, the lack of real understanding of how to utilize the resources and utilize them appropriately continues to cause us to lose people unnecessarily.
I think it's very important to treat this as a war, and unless you have goals and objectives, it's very unlikely that you're going to see progress.
Cancer is fought one soldier at a time, one person at a time. It's a personal battle. You're staring death in the face. But by the same token, you've got that whole logistical chain and all of the other leaders involved in a greater mission.
By setting specific priorities with specific outcomes, the MCC has been able to contribute toward the advancements in cancer control at a much faster pace. These contributions include screening guidelines for breast, cervical, and colorectal cancer, public education media campaigns to promote cervical cancer screening, and prostate cancer education materials, to name a few.
The objective that I'm most closely tied to is the educational initiative for prostate cancer patients. That led to materials that are very user-friendly, very understandable to the lay public. These materials are so good that they're now disseminated nationally, even internationally in some cases.
One of the priorities for the Michigan Cancer Consortium was to have a common lexicon for reporting cancer pathologies. So I took on the task of trying to distill all their ideas into a common lexicon that is usable throughout the state.
One of the projects we did that we were very, very proud of is a program called Free to Be, and that is a awareness program that we did to really outreach to underserved minority individual women.
The breast and cervical program is saving lives in the community.
Had I not been a member of the MCC, I don't think that I would have even understood the value of bringing the services to the underserved.
We use the BCCC program quite a bit because, again, we do service the uninsured. Otherwise, they would have no means of getting a mammogram.
In Michigan, we are one of the states with very high cancer rates, but we're also one of the leaders in terms of cancer control. And the consortium really has put Michigan on the map as a national leader among states in comprehensive cancer control programs.
Michigan's always been out there. They've always had good thinkers at the table. They've always had a good collaborative sense. And they're the ones who help spark a lot of other programs and say, this is what we're doing, and you can do this too. Michigan's always been a very strong model on the national level.
Cancer is you run amok. Understanding that, trying to get at that, both from a scientific point of view, a clinical point of view, and from the MCC's perspective, from a community point of view, are just all pieces of the puzzle that go together towards reducing this disease. I would love to be put out of business.
With the Michigan Cancer Consortium, it seems as though people leave that competition at the door and they come together for a common cause, and that cause is to reduce the incidence of cancer in the communities that we all live in.
I think the public-private partnership is unique and really adds value in that government has a role in as a convener, as a regulator, as a payer that's a little bit different than other organizations. And you can bring our role together with that of the medical community and the voluntary organizations like the Cancer Society, and we each have access to different groups of people, different resources, and so you get, again, a synergistic effect in the use of those resources, and you get much greater results.
We will not reduce these morbidities and mortalities in the cancer area unless we work together. This is really the soul of the MCC, working together. And we have proven in the MCC that we could work together, we could lend support to each other, and we could utilize the expertise and experience of each other and share resources.
It's really important to the average person in our state to think that wherever they end up having their cancer diagnosed, that they have a reasonable chance that the quality of service that they get in that community or the referral that they get to the expert that they need is going to have the end result in them getting the quality care that they need to beat the thing.
I think other organizations should join the MCC because we all have this desire to do something about cancer, and each of our organizations brings something unique to it.
We all have a stake in the health of our community. I think CEOs of businesses, one of the major concerns now is health care, and as the health costs are spiraling, the best way to reduce health costs is to improve the health of those that work in businesses. The best way to do this is cancer prevention and health promotion.
We are trying to bridge the isolated viewpoints of very specialized organizations so that we all talk to each other and we all see how we are all interrelated.
I think we need to build bridges and build trust in the communities so that we can work together to reduce cancer incidence and mortality.
Everybody has a role to play. Everybody brings something to the table. The clinicians, the researchers, the advocacy organizations, and the patient.
Don't let cancer silence you, because it will either silence you through death or fear, and neither of them have to be. We can talk about it, we can educate about it, and we can improve the quality of life overall by working together to increase knowledge, increase awareness, reduce the myths, and live healthier lives.
Please support the Michigan Cancer Consortium. There's so much more we can do together.